working to connect a region of over 600 million bridges between our lands.
Hello, I'm Alma Angeles. You're watching ASEAN in Focus, and we're coming to you live from Manila in Vietnam. Hello, Eliana.
Hello, I'm Eliana Faith Sebastian from EBC Vietnam Bureau, giving you the news in the dynamic ASEAN region.
On today's headlines, Thailand reimposes COVID-19 restrictions on restaurants, construction sites, and gatherings in the capital and its suburbs as it tries to contain a wave of coronavirus cases. And we have live with us the Honorable Millicent Cruz Paredes, the Ambassador of the Philippines in Thailand.
President Duterte extended the General Community Quarantine or GCQ classification in the National Capital Region Plus, with Laguna and Cavite still under heightened restrictions until July 15.
Malacanang vowed to implement the government's action plans to address all anti-money laundering and counter-terrorism financing deficiencies of the country.
Rio Goyamasaki grabbed the first half hat trick as Nagoya Grampus thrashed Ratchaburi FC 4-0 to close in on a last 16 berth from Group G in the Asian Champions League on Monday.
And we are honored to have on our program the Honorable Millicent Cruz Paredes, the Philippine Ambassador to Thailand. Welcome to the program, Ambassador.
Good afternoon.
Thank you very much for your time and for accepting our invitation. And I would like to begin this interview with the news that Thailand has reimposed coronavirus curbs by reordering restaurants in its capital city, Bangkok, and nearby provinces to suspend dine-in services. Could you please tell us more, Ambassador, about the current situation there in Thailand?
That's correct. So, currently, we are now under a third wave of the COVID pandemic. They had their second wave early this year, around January. But now that they are increasing number of cases, it's around 4,000, between 4,000 and 5,000 right now. So these restrictions. They prohibited dine-in for restaurants, also gathering, and also construction. They've halted the construction because there's a lot of clusters within construction site.
When we say construction, meron po ba tayong kasamang mga kababayan po nating Pilipino doon, Ambassador?
We have not heard of any because the Filipinos here in Thailand are essentially skilled workers. Most of them are English teachers spread all over Thailand.
Yes.
So we have not heard of construction workers here who are affected by the pandemic.
That's good. And then since we're in the topic of our Filipinos there, can you please tell us, kumusta naman po? How is our Filipino community there? Were there any Filipinos affected by the COVID-19 recently there in Thailand po?
Yes. So I was able, before this current lockdown, I was able to bring my team for a consular outreach to at least 2 provinces. The first one is in Chiang Mai, and then in Phuket. I was able to talk to the Filipino community there. I was also able to talk to 2 major Filipino community organizations that are based here in Bangkok. And they have said that indeed a lot of Filipinos have been affected, just like the rest of the people here in Thailand, of course, because of the economic downturn, because of loss of the loss of jobs that resulted from that economic downturn. You know that Thailand is very much dependent on tourism, and right now the country is closed to tourism. So definitely a lot of Filipinos are affected. But the good thing is we continue to help them. We are open to helping distressed Filipinos. We have a few repatriation projects that we have implemented since last year. Even before I arrived here in November. So even before I arrived, when
Yes.
the pandemic first hit, we were already doing repatriation.
Okay.
Right now, it's also difficult to fly back to the Philippines because of the limited slots of
True.
arrivals.
Yes.
So that is what is facing now the Filipinos here. Medyo mahirap umuwi ulit. We are doing our best. We are coordinating this with both the carriers and also the authorities back home.
Yes.
And somehow we're able naman to also send home our stranded Filipinos here. But of course, we wait our turn because I understand that they're also allocating the slots not only here in Asia but more so in the Middle East, America.
Aside from repatriation, ano po yung what support do our Filipino community there get from the government po?
So we have our continuing assistance to nationals program.
Okay.
Kung ano man ang pangangailangan nila, well, of course, we have to assess that indeed they are Filipinos in distress. Then we are ready to help whatever assistance they may need. We continue to provide our consular services. We have imposed, of course, COVID protocols in our consulate in order to, make sure that nobody will be infected or nobody will be affected here. So we have imposed an appointment system. But of course, if we are able to accommodate even the walk-ins, then again, we continue to provide consular services. But right now, we're sorry to say that we have to stop our consular outreach to the provinces because domestic travel is very difficult. We have to be quarantined also upon
Yes.
arrival in some provinces. We have to stop that consular outreach. So that is, I have already announced that to the Filipino community organizations here that for now we will have to stop that. But as soon as the regulations are lifted, then we will proceed again with our consular outreach.
I know that you're right. I know that in some other countries, Filipinos are helping themselves or helping each other by, let's say, pantries like here po. There po, paano po silang nagtutulungan now? Despite the lockdown and the restrictions, paano po nagtutulungan ang ating Filipino community po dyan sa Thailand?
Yes. We have also coordinated with the Philippine organizations. What is heartening here is that the Philippine organizations are helping our fellow Filipinos, and that is where we coordinate with them whatever it is they need. From last year, even before I arrived here, our personnel here in the embassy had to shell out personal funds just to provide food assistance. So we continue to coordinate with the Filipino organizations, whatever it is they need, whatever it is we can help them with. At natutuwa po akong sabihin na ang bayanihan dito sa Thailand is very much alive and kicking. So we are helping each other.
That's good to hear. The first case of the Beta or the South African variant was discovered in Bangkok. And that's why the new lockdown restriction measures were also imposed. And the construction sites, as you were saying earlier. Can you tell us more? Do you have any news about this or more information?
I think there's already at least one case of the Delta variant, and they are preparing for the Delta variant to be the major variant of concern in the coming months. So that is what the government is saying as the reason behind the current reimposition of regulations and restrictions. But of course, there's been a lot of negative feedback, especially for small business owners, because closing of, for example, the dining in small restaurants, it's not allowed anymore. They're saying that it really is affecting their daily livelihood. No? They're very source of income. So, and again, I'm sure this situation is not unique to Thailand, except that as I mentioned earlier, whatever it is they're experiencing now is what we experienced even last year. I was still in Manila when the full lockdown was imposed.
Yes.
Here, they have not really imposed full lockdown measures, meaning hindi katulad natin dyan, only the parang head of family would be able to go out, the seniors are not allowed, the youth are not allowed.
Yes.
But here, there's freedom of movement, except that no dining in, no massage. The massage establishments are closed, which is
Yes.
they really have a lot of those.
Yes.
establishments.
Thailand is known for that. Yes.
Yeah.
That's true.
So marami talagang affected.
That's right. Also, moving forward, kasabay po nung, together with the resurgence of this virus, recently there was this people movements protest. And what is the scenario there right now, given the political situation and the health situation at the same time?
Yeah, what I know about the protest is also what everybody else would know, because our source then is the media. Of course, we don't want to. We monitor all of these, but the protests have somewhat gone down compared to last year's. Perhaps also because they're now very conscious also about the COVID situation here. It was very different between now and last year. Last year, they were able to maintain a zero case for a long time. And then after that, it increased to just single digits for a few months. And it's only just recently that their numbers have gone up to the thousands. So I think that is also part of the reason why there's not much action there right now.
COVID-19 patients also in the news is suffering only, for those COVID-19 patients who are suffering only mild symptoms, I think health authorities have told them to self-care at home under a monitoring set up by a medical staff. How is the situation of hospitals there, Ambassador?
Yeah, initially, what they imposed was that the moment you are found positive, you are supposed to go to the hospital, and
Yes.
you will have to stay in the hospital, whether or not you have the symptoms. But now, because of the rising numbers, they now became more flexible. Those without symptoms would have to isolate at home in order to reserve the hospital beds for those who are really in need. for those who are in need of critical care. And just like the situation back home, the beds, the critical care beds are really very much in high demand. So they are reserving that for those who really need it. So now they've allowed the self-isolation at home if there is no symptom, except that you will really have to be monitored by the government. That they would know. Ang kanilang contact tracing here
Yes.
is, I think, what is helping them through this pandemic. They know who are sick. They know which cluster to contain. So that is what is very good here in Thailand.
Oh, that's good to know. And also, earlier we were talking about the sandbox, Phuket sandbox. Can you tell us more about what this is?
Okay, so from what I understand, it's their way of slowly opening up their tourism sector. Because as you know, Thailand is very much it is a big draw of tourists from all over the world.
True.
But that everything had to stop because of the pandemic. Now they're trying to open up little by little. Right now, what is part of the regulation for entry is a mandatory 14-day quarantine in what they call ASQ, or a hotel, where you will have to be quarantined and cared for by a hospital that they are partnered with. So in their attempt to open up Thailand for tourists, for tourism, what they did was to make the Phuket Island, the quarantine itself. You don't need to quarantine yourself in a hotel.
Okay.
You may already enter Phuket without the need for a hotel quarantine, but you will not be able to exit outside of Phuket because the whole island is your quarantine. You can move within, but you can travel out only after the mandatory period. But right now, I think they will impose that or implement that by July 1st. That is the latest schedule I know. But I think they tried to open up much earlier, but because of this third wave, they had to delay. We don't know really if they would be able to open by July 1st, but remains to be seen. But that is what they are trying to do.
That's good. It's quarantining in an island that's surrounded by beach and waters, and what a way to quarantine yourself. Ang galing po, ano. And when it comes to vaccinations, have you encountered any problems with vaccination programs, just like other countries in the world?
Yeah, just like, again, the problem is not unique to Thailand. It's really a problem of supply. Even among us diplomats, we are not able to... Well, some of us already had our first, even our second doses, but for example, here in our embassy, some of us have tried, but we are given a much later schedule. I was able to already get it on I was able to have my first dose on our Independence Day, June 12. So after our rites here at the embassy, in the afternoon I was able to go to the hospital and had my first dose. And then I heard from my meetings with the Filipino community, mayroon tayong mangilan-ngilan na Filipinos who were able to already have their vaccination under the auspices of their employers, usually yung schools.
Yes.
But in general, supply is really a problem. Even Thais, they have not been able to give enough vaccinations to their own nationals. Other foreigners here, I have heard a lot of complaints. I see a lot of letter of complaints in the newspaper about not being able to register, or if they're able to register, their schedules are not immediate. So I guess, and as you know, we also announced recently that the delivery of our orders for vaccines from Thailand would be delayed. So I think that's really a problem of not only unique to Thailand, but for the world.
Yes. So it's really a matter of supply, ma'am.
That's right.
That's right.
That's right. But I understand that the Thai government is doing its the best, just like our government, in order to cover more of the population, because of course they know that they really have to cover as much as they could in a shorter period. So hopefully, just like in the Philippines, unti-unti dumadating ang mga supplies. So hopefully, we would have a faster rate of the rollout.
And the status, yes, ma'am. Ma'am, the status of our flights inbound and outbound in Thailand po.
As I mentioned earlier, we have been given very little slots in the overall allocation of landing or entry into the Philippines. Because compared to, for example, Middle East, there would be much more Filipinos going home from the Middle East compared to Thailand. So for a while, there were a lot of stranded Filipinos here in Thailand. Again, we were coordinating this with both the carriers and also authorities back in the Philippines, just to allow more slots for Thailand. And we were able to do that. So little by little, we are able to allow the transfer of more Filipinos from Thailand to Manila or to the Philippines. So as long as there is that cap of arrivals in the Philippines, then it will not be easy. But right now, there are less stranded Filipinos in Thailand now than compared to when it was at its peak a few weeks back.
Tourists, are they given free vaccination like in other countries?
I would think that is the part of the plan of the Thai government. But right now, there is no supply yet for tourists. There is no supply even for foreigners who are legal residents here. So, and even the local local Thais here, not a lot have been inoculated. So, but I think that is really part of the program to vaccinate everyone, including incoming tourists, I think.
Okay. Yes, ma'am. Can you, do you have any message for our Filipinos, relatives, friends who are watching you right now?
Okay, so you know what? During our rights for the Philippine Independence Day, the 123rd anniversary of our independence, last June 12, part of my message to the Filipino community here in Thailand is, as a good gesture of the Filipinos to our host, which is Thailand. I encourage the Filipinos here to donate blood, to heed the call of the Red Cross of Thailand for more blood donations because of the current health crisis here.
Yes.
So even before I made that call, I already donated. I went to the nearest Red Cross Center here and donated blood because diba, parang how can I make a call when I haven't done it myself? So
yes.
And on the day itself of our anniversary, I made that call for the Filipino community, as a good gesture for our host from the Filipinos that we are one with them in this health crisis. And if there is something we could do to directly help, then it is to heed the call of the Thai Red Cross for more blood donations. And so we had our Independence Day on June 12th. On the 14th of June, that was our 72nd anniversary of the Philippines-Thailand diplomatic relations. And I said, what better way to mark the anniversary than, for Filipinos to be donating their blood to the Thai Red Cross. And it turned out, that on that day, the 14th of June, was actually a blood donors day. The World Blood Donor Day. Diba? So what a coincidence, diba? Na,
Yes.
That on the day of the Blood Donor Day, here we are, the Filipinos, offering our blood donation in Thailand. So, and it also was parang tamang-tama din sa ating Independence Day theme of 2021, which is diwa ng kalayaan sa pagkakaisa at paghilom ng bayan. So it's not only yung bayan natin ang naghihilom, di ba? Parang we Filipinos out there all over the world, we should be part of paghilom ng buong mundo. So yun ang mensahe ko noon sa mga Filipinos here in Thailand.
Very good message, ma'am. And of course, we are also all hoping for all the economies of ASEAN countries to experience a resurgence at the soonest time possible, so we can all come out of this healthy and hopefully very soon po. Maraming salamat po. Thank you for your time, Ambassador. And please do stay safe, and thank you for taking care of our Filipino community there.
Thank you.
Thank you, Ambassador Millicent Cruz Paredes from the Philippine Embassy in Thailand. And we will be right back.
Ang trabaho naman talaga ng maritime group ng PNP is to enforce the maritime law.
Tayo lang yung stricto, pero in other parts of the country, pwede na naman ang tourism.
Definitely, we are ready to respond to a possible spike.
Sapagkat ang aming intensyon ay makatulong lang sa mga tao na wala talagang magamit na gamot.
92 voted for this resolution, which will make it stronger, calling on the Justice Department to come up with more stringent ways to be able to avert these hate crimes against Asian Americans.
Mas marami po tayong magagamit ngayon na mga tools or mga equipment.
Maraming salamat, Weng, at sa buong puwersa ng Balitalakayan sa pagkakataong ito.
Tatalakayin ang mga pangunahing balita live sa teleradyo ng Net25 at Radyo Aguila DCEC 1062. Kasama si Weng de la Fuente sa Balitalakayan.
We live in interesting times.
The Delta strain is expected to dominate Bangkok in a few months. Jazz Diona joins us live from Thailand. Hello, Jazz.
Good afternoon, Alma. And yes, here in Thailand, 1/3 of COVID-19 patients in Bangkok will be tested to determine whether they have been infected by the Delta coronavirus variant, as the strain is expected to dominate in the capital within the next few months. This is according to the Department of Medical Sciences. The department reported on Monday that the Delta variant, which was first detected in India, has affected Bangkok largely, with 331 new cases being recorded last week, increasing the number of patients infected by this particular variant to 822. For comparison, the Alpha variant, which was first detected in the United Kingdom, was reported to have 2,300 cases in Bangkok. Based on the report provided by the department, Bangkok detected 25.66% cases of COVID-19 patients were of Delta variant, which was an increase compared to the 23.67% cases from the previous week. Meanwhile, alpha strain infections declined from 76.33% to 74.31% over the same period. Statistics also show that the Delta variant is found less in other provinces, but are still continuously increasing. In 5.05% of all accounted cases, 2.58% is from the Delta variant. However, the department added that Alpha strain is still dominant strain outside Bangkok. In the whole Kingdom of Thailand, the department reported that from 9.76% in April, the Delta strain went up to 12.3%. It said that Alpha strain cases have increased from 86.31% to 89.62% over the same period. Moreover, Alma, according to Dr. Supakit, on the figures and numbers that the capital has been reporting, Bangkok will eventually be dominated by the Delta variant in the next few months. With this, he encouraged the people to follow the containment measures to prevent the disease infection, including getting inoculated as a priority. Regarding the efficacy of the Sinovac vaccine, he insisted that the jab is 70.9% effective against the Alpha strain. The doctor also addressed the worries and hesitation of the people when it comes to the effectiveness of the vaccine and getting inoculated, with his statement saying that many studies found that all vaccines can reduce the chances of infection when compared with those who are not vaccinated. The department recently found 2 cases of the Delta variant in Narathiwat province among returnees from Malaysia, making it the first case of its kind in this south. This update is from Bangkok Post. Back to you, Alma. Likewise, Alma reporting live from Thailand. This is Jastiana, and we live in interesting times.
According to Bangkok Post, the government will confine construction site workers. Here's Veronica Carino to give us the update. Hello, Veronica.
Hello, good afternoon, Eliana. The Interior Ministry has instructed all provincial governors to tighten restrictions to prevent worker migration. The government has imposed limits on the movement of construction workers who will be restricted to their temporary shelters for at least 30 days at 50% pay due to an increase of COVID-19 infections. Construction sites and workers' camp are high-risk zones, and limiting employees' movement is critical to reducing coronavirus incidents and avoiding bed shortages, according to the Interior Minister Anupong Pauchinda. When asked about media allegations that some workers had defied the isolation orders by leaving their camps to acquire supplies, he stated food and construction enterprises are working together to supply food and basic materials to the workers. Following rumors that many workers had returned home over the weekend to avoid being stuck in the capital, he added that the local leaders and village volunteers are closely monitoring arrivals in their towns. Professor Prasit Watanapa, Dean of Sirirat Hospital, Faculty of Medicine and Government Advisor, said all provincial communicable disease committees were informed of the shutdown ahead of time so they could prepare for returning personnel. He predicted that the number of illness would arise much more as a result of the mass testing that is currently taking place at several of the restricted sites. Security forces were ordered to protect construction camps and employees living in facilities on Friday, according to Bangkok Metropolitan Administration, BMA officials, and by Sunday, 77 out of 575 camps in 50 districts had been entirely sealed off. This update is from Bangkok Post. Back to you, Eliana.
All right, thank you for your updates, Veronica. Stay safe and stay healthy.
Thank you, Eliana. And likewise, reporting live from Thailand, this is Veronica Carino, and we live in interesting times.
President Rodrigo R. Duterte on Monday extended the General Community Quarantine or GCQ classification in the National Capital Region Plus, with Laguna and Cavite still under heightened restrictions until July 15. In his pre-recorded talk to the people, Duterte said GCQ will also continue to be imposed in Metro Manila, Rizal, and Bulacan with some restrictions until July 15. Aside from NCR Plus, Ifugao Province, City of Santiago, Guimaras, Aklan, Bacolod City, Negros Occidental, Antique, Capiz, Zamboanga, Sibugay, City of Zamboanga, Agusan del Norte, Surigao del Norte, and Agusan del Sur will also be placed under GCQ in the next 15 days beginning July 1. The GCQ will be imposed in Baguio City, Isabela, Nueva Vizcaya, Quirino, Batangas, Quezon, Ilagan City, General Santos City, Sultan Kudarat, Sarangani, Cotabato, South Cotabato, and Cotabato City until July 31. Meanwhile, Duterte also placed Cagayan, Apayao, Bataan, Lucena City, Puerto Princesa, Naga City, Iloilo City, Iloilo, Negros Oriental, Zamboanga del Sur, Zamboanga del Norte, Cagayan de Oro City, Davao City, Butuan City, Dumagat Islands, and Surigao del Sur under stricter Modified Enhanced Community Quarantine or MECQ from July 1 to 31. Davao Oriental, Davao Occidental, Davao de Oro, Davao del Sur, and Davao del Norte are also under MECQ, but only up to July 15. The rest of the country will be placed under modified GCQ. Presidential spokesperson Harry Roque said gyms or fitness centers at 40% capacity and other indoor sports courts at 50% capacity will be allowed in Metro Manila, Rizal, and Bulacan, but not in other areas of NCR Plus like Laguna and Cavite. He said 40% capacity for historical sites and museums will also be allowed in the NCR Plus areas, except in Laguna and Cavite. The non-contact sports are allowed in GCQ and MGCQ areas, while individual outdoor exercises are allowed within the general areas of their residence in MECQ places. Roque said outdoor dining or alfresco will 50% capacity will be allowed in GCQ and MGCQ, but not in MECQ areas. He added that indoor sports, courts, and venues, as well as indoor tourist attractions, can operate up to 50% capacity GCQ areas, but should be closed in MECQ places as well as in Laguna and Cavite. Duterte reminded the public to strictly observe social distancing, as well as the wearing of face masks and face shields outside their homes to prevent the spread of COVID-19, particularly the more infectious Delta variant.
To Cambodia now, the death toll from COVID-19 has increased exponentially from 1 on March 11 to 540 on June 27. Now, between June 21 and 27, 99 deaths have been recorded across the country, with Phnom Penh recording the highest death toll as of June 21st, with 237 deaths, followed by Kampong Speu with 32 deaths, Sinaguville with 21, Bantay Menchay with 23, and Takeo with 20 as of June 21. 4 other provinces have double-digit deaths as of June 21 too. The country also has a higher number of deaths per million citizens as compared to its immediate neighbors. Cambodia has almost 28 deaths per million, whereas Thailand and Vietnam, which are also seeing recent surges in COVID cases, 23 and less than 1 death per million respectively, according to data from the Johns Hopkins University's COVID-19 dashboard. Now, Dr. Nuth Sambat, who heads the Institute of Biology, Medicine and Agriculture at the Royal Academy of Cambodia, said that the increase in deaths revealed that Cambodians have pre-existing health conditions that are making them vulnerable to the virus. He said, quote, most of the deaths are among people who are obese, with chronic diseases, and over 65 years old.
Health Secretary Francisco Duque III on Monday administered the country's 10 millionth dose of COVID-19 vaccine to 74-year-old Nieves Katakutan in a ceremonial vaccination in Valenzuela City that highlights the government's vaccination program. Katakutan, a resident of Barangay General T. De Leon, Valenzuela City, received her first vaccine shot under the A5 priority or indigent priority group category of the vaccination rollout that started on March 1 this year. The latest data of the National Task Force Against COVID-19 shows about 10,065,414 vaccine doses have been administered nationwide as of June 27. Of the number, 7,538,128 Filipinos have received their first dose, while 2,527,286 are fully vaccinated. The country's average jab rate over the last 7 days is at 236,867 doses across 1,231 active vaccination hubs. Valenzuela Mayor Rex Gatchalian thanked the national government for supporting the city's vaccination program.
The Philippine National Police Chief, General Guillermo Eleazar, ordered on Tuesday the Criminal Investigation and Detection Group, or the CIDG, to look into the illegal operations of fixers who seek payment from people who want to get vaccinated right away by having their schedules moved up. Eleazar issued a directive after Pasig City Mayor Vico Soto disclosed that 2 fixers were caught asking fees in exchange for allowing persons to get COVID shots ahead of their schedules in the vaccination program. Eleazar appealed to the public to avoid falling prey to the scheme and had urged them to patiently wait for their scheduled vaccination. Vaccination is offered free, and the public only has to register and wait for their schedule. The public is urged to report to authorities any information about vaccination fixers through the PNP's different e-Sumbong platforms.
Myanmar authorities burned over $500 million worth of narcotics across the country Saturday, sending opium, heroin, and methamphetamine up in smoke as experts warn smugglers have adapted to COVID-19 travel restrictions and are back in business. ASEAN and Focus will be back after a short break.
sumaya tayong lahat. Saya-saya.
Hey there, Arnie Aquino here at Hatley Castle, one of the filming locations for the X-Men series. Don't forget to tune in to Digital Nest only on Net25.
Events happen around us all the time, in our community, in our country, around the world. Events that affect people, move communities, or simply inspire us. Interesting events that people need to know. In these interesting times, we continue to be a competent partner in delivering news about these events. Fast, accurate, balanced, eagle news, because we live in interesting times.
Welcome back to ASEAN in Focus. Negotiations are already in progress between the Philippine government and a Canadian biopharmaceutical company to set up a vaccine manufacturing plant in the country, Philippine Ambassador to Canada Rodolfo Robles disclosed Monday. In an online palace briefing, Robles said the negotiations with Medicago would proceed more rapidly and formally after getting the non-disclosure agreement approved by the Philippine government through the Department of Science and Technology, or DOST. Robles said the Philippines has also expressed interest in getting some of the excess COVID-19 vaccines of around 100 million doses from Canada. He said Canada has 180 million COVID-19 vaccine doses with a population of only about 40 million. Robles said Canada is expected to have its population fully vaccinated by the middle of the fourth quarter this year.
In other news, an official of the Metro Manila Council, or MMC, said individuals caught dumping garbage in the Pasig River or in any waterways in the National Capital Region may soon face uniform penalties. In a statement, MMC and Metropolitan Manila Development Authority Chair Benjamin Benher Abalos Jr. said that harmonizing the ordinances against those who keep throwing trash into waterways is one of the topics being discussed by the MMC members. Most of them are NCR mayors. Abalos said, quote, "We will make a uniform ordinance to mete out sanctions or conduct community service for those who recklessly throw garbage." As a more concrete step in keeping waterways clean, he also said the MMDA has installed floating trash nets to block garbage from entering its pumping stations. During his inspection of the installation of trash traps in one of the tributaries of Estero Tripa de Galina in Pasay, he said 2 truckloads of trash daily are collected in this area alone. He also said a total of 32 truckloads of trash are collected daily from all 57 pumping stations in Metro Manila.
Philippine National Police Chief General Guillermo Eleazar on Sunday welcomed the concern raised by the Commission on Human Rights over President Rodrigo Roa Duterte's suggestion to arm the police partners in fighting crimes and terrorism. On June 25, the PNP launched the Global Coalition of Lingkod Bayan Advocacy Support Groups and Force Multipliers that aims to build a strong collaborative partnership with the community in support of the ongoing campaign against criminality and terrorism. In his message, President Duterte declared he was open to issuing firearms to a new group of volunteers to help government forces enforce the law.
You want to participate in the prosecution of the crime, you can have a gun And if you're qualified, I will ask the police to give you the license. But please try to observe the law. If you want, you invite me once again when you are ready, and I will lecture to you the law on arrest, search, and seizure. As a policeman, yan lang ang ano. I was teaching criminal law, criminal procedure, criminal evidence during my prosecution days.
Eleazar said in a statement that they understand the concern of the officials of the Commission on Human Rights, but we assure them that the President's suggestion is to encourage volunteerism and definitely not vigilantism. Eleazar also said Duterte's recommendation aims to protect the civilian volunteers against the criminal elements, including members of the New People's Army, the armed wing of the Communist Party of the Philippines that is listed as terrorist organization by the United States, the European Union, the United Kingdom, Australia, Canada, New Zealand, and the Philippines.
In a related news, President Duterte's proposal to arm civilian volunteers in fighting crime is not a policy yet. That is according to Malacanang yesterday. In a palace briefing, presidential spokesperson Harry Roque said while President Duterte is open to the idea of arming anti-crime volunteers, the proposal still needs to undergo the process of completed staff work. Take a look.
Pero wala pa naman pong finality, no? At siguro the best view expressed so far is the view of PNP Chief Eleazar, no, which I share, no, that kailangan intindihin naman natin na kapag ang mga volunteer groups ay merong banta sa buhay nila, meron din silang karapatan na depensahan ang kanilang mga buhay. Now, sabi nga po ni Chief PNP, we cannot allow these criminals. We cannot allow our volunteer groups to be at the mercy of criminal elements that we encourage them to fight alongside with us. No, so there's not a policy yet. I'm sure it will be subjected to full staff work. Pero meanwhile, may realidad na habang tumutulong ang mga volunteers, may banta rin sa kanilang mga buhay.
Quezon City employees reported for work during the enhanced community quarantine and modified enhanced community quarantine will soon receive their hazard pay. The local government has allocated 250 million pesos for the payment of the hazard pay to eligible employees who helped in their delivery of services and programs to residents during the covered period. All our workers on duty deserve to be fairly compensated for their sacrifices, especially since they face the inevitable risk of contracting the virus, Mayor Joy Belmonte said in a statement on Monday, referring to Ordinance SP 3025 or the grant of the COVID-19 hazard pay. Belmonte said without dedicated employees, the city government will not be able to bring services to its constituents. The ordinance provides that employees who reported for work during the ECQ and MECQ will be granted a hazard pay in an amount not exceeding 500 pesos per day per person. A hazard pay of 200 pesos per day will also be granted to barangay officials, both regular and contractual.
The Philippine government commits to correct its deficiencies after the country returned to the gray list of the Financial Action Task Force, or FATF, an international watchdog that aims to combat money laundering and the financing of terrorism. This means we as a country made commitments to correct deficiencies within a particular time frame. Hence, it's under increased monitoring, according to Finance Secretary Carlos Dominguez. He told this to reporters in a text message. Aside from the Philippines, Philippines, Haiti, Malta, and South Sudan also landed on FATF's gray list. In a separate statement, Bangko Sentral ng Pilipinas Governor Benjamin Diokno said the country will submit its first report in September this year. And Mr. Diokno said the Philippines has adopted compliant laws and regulations, but it's not sufficient, and the Philippines need time to implement them to demonstrate the effectiveness of anti-money laundering and counter-terrorism financing measures. He added that although the Philippines was reverted to the dirty money watch list, the country will not face any sanctions for being a jurisdiction under increased monitoring.
Malacanang on Monday vowed to implement the government's action plans to address all anti-money laundering and counter-terrorism financing deficiencies of the country. Presidential spokesperson Harry Roque made the statement after the Global Dirty Money Watchdog Financial Action Task Force has included the Philippines in its gray list of countries under increased monitoring because of its policies and laws against money laundering and terrorist financing.
Wala pong countermeasures imposed. So wala pa pong desisyon. Ibig sabihin lang nito, increased monitoring. No? At tayo naman po ay nangako na ipatutupad yung ating action plan kasama po nung pag-amenda ng passage ng yung anti-money laundering at saka CTF laws, yung enhancement ng ating AMF at CTF supervisory framework, reinforcement of money laundering and terrorism financing investigation and prosecution, and campaigns to increase public awareness. So wala pa pong desisyon. They will monitor our progress. So we have not been put under any negative list. Pareho pa rin po tayo, but they want to see further improvements.
He said inclusion in the gray list usually means a country will have to comply with recommended reforms within a given time frame before the imposition of financial sanctions. Inclusion in the FATF's gray list will result in additional layers of scrutiny from regulators and financial institutions, delayed processing of transactions, and clocking the country's road to an A credit rating.
And finally, in our news, Ryogo Yamasaki grabbed a first-half hat trick as Nagoya Grampus thrashed Ratchaburi FC 4-0 to close in on a last 16 berth from Group G in the Asian Champions League on Monday. Now, it was the third straight victory for the Japanese side after they notched up wins over Pohang Steelers and Johor Darul Tazim last week, when the competition's matches involving clubs in the continent's eastern zone got underway at venues in Thailand and Uzbekistan. Group stage matches in the western zone ended in April with 5 toppers and 3 best second-place teams making the knockout phase of the expanded tournament. With rain pouring down at Bangkok's Bangkok's Raja Mangala Stadium on Monday, Thailand's Ratchaburi, one of the several sides making their debut in the event this year, were clearly left wondering whether they are up to the task at this level after suffering their third consecutive defeat. The Thais barely managed a clear chance at goal and fell behind in the 28th minute, with the tall Yamasaki heading home off a perfect cross from fellow forwarding Matthews from the right. Yamasaki added to the tally just 3 minutes later with another header, this time from an assist by Yutaka Yoshida from the left flank. The 28-year-old grabbed his hat trick with an easy finish in first half stoppage time after Ratchaburi goalkeeping Kampol Pato Makul could manage to parry the ball in his direction while attempting to stop a shot from Sho Inagaki. Manabu Saito completed a miserable day for Ratchaburi with a neat finish in the 69th minute, taking advantage of a pass from Taguchi Yonemoto. Also in Group G, South Korea's Pohang Steelers scored twice in each half as they eased past Malaysia's Johor Darul Tazim 4-1 for their second win in 3 matches. Johor took a surprise 17th minute lead through Argentinian Leandro Velasquez, but that was their lone bright spot as the desperate Malaysians conceded 3 penalties later and lost the plot. Boris Tashi, Kang Sang-woo, and Lin Sang-yub scored from the spot, while Kwon Ki-pyo accounted for their only field goal. In Group H, 2-time former champions John Book Hyundai Motors wasted their early 2-0 advantage share points with Gamba Osaka. Their 2-2 draw meant both sides are on 4 points from 2 matches, with Gamba Osaka on top of the table on goal difference. John Book drew first blood in the second minute of play, with German forward Stanislav Iljutenchenko finding the target from an assist by Yan Kyo-won. Takahiro Kunimoto made it 2-0 in the 17th minute, but John Book hit back with 2 goals inside 5 minutes by Brazilian Anderson Patrick to force a draw at the Lokomotiv Stadium in Tashkent. Patrick first struck in the 27th minute by finishing off a pass through Hiroki Fujiharu, and then completed his brace with a 31st minute goal on an assist by Shinya Yajima. Also in Group H, that side, Chiang Rai United ripped Singapore's Tampin Rovers with Siwakorn. Tia Trakul netting the winner in the 87th minute in Tashkent. It was the first win for Chiang Rai, who were beaten 2-1 by John Book Motors in their opening match last Friday, while the Rovers suffered their second straight defeat. Thank you very much, Eliana, for keeping me company today.
Thank you, Alma, and that's the latest news in the ASEAN region. Thank you for joining us today here in ASEAN in Focus. I'm Eliana Faith Sebastian from EBC Vietnam Bureau, and we live in interesting times.
We'll see you back tomorrow. I'm Alma Angeles. We live in interesting times.